Okay, let's dive into this. Welcome to today's explainer, where we're going to uncover a hidden microscopic battle taking place right under our noses, or, well, actually, inside our dogs. We're looking at a disease called Canine Babesiosis. It's a complex, absolutely fascinating, and quite frankly, terrifying biological process. But don't worry, by breaking it down step by step today, we are going to completely demystify the whole shebang. So picture this for a second. Imagine your dog happily bounding through the tall grass at the local park. They're just having the absolute time of their life. But lurking in that grass is a tiny tick, just waiting to hitch a ride. Your dog gets bitten. You might not even notice it. But I want to ask you, what exactly happens inside your dog's body when that tick bites? We aren't just talking about a little itchy bump here. We are talking about the introduction of an invisible danger that can set off a massive, system-wide war straight into your pet's bloodstream. Here is our roadmap for today's explainer. First, we'll meet the parasitic invader. 2, how the infection spreads. 3, the microscopic blood battle. 4, organ system meltdown. 5, spotting the warning signs. And finally, 6, diagnosing canine babesiosis.
Starting with part 1, meet the parasitic invader, the hemoprotozoan threat. It's really crucial to frame this not just as your standard illness, but as a literal biological home invasion. Canine babesiosis is a tick-borne hemoprotozoan disease. Now, I know that's a mouthful, but let's break it down. Hemo refers to blood, right? And protozoan refers to a single-celled microscopic organism. So this disease is caused by intracellular protozoan parasites from the genus Babesia, and their sole mission, to infect and completely destroy a dog's red blood cells. Because of this relentless attack, these specific parasites are recognized as one of the most important causes of hemolytic anemia in dogs worldwide. They literally break the blood apart from the inside out.
Moving to section 2, how the infection spreads. Infiltration routes.
Now, what's really wild is how the parasite actually enters the dog. The tick acts as a biological vector. It's essentially a living syringe. Let's walk through it. It starts when a tick feeds on a dog that's already infected. The Babesia parasite gets swallowed and enters the tick's gut. But it doesn't die there. Instead, it thrives, multiplying like crazy inside the tick's digestive tract. Next, it migrates all the way up to the tick's salivary glands, and it waits there. It just waits until the tick latches onto a new, healthy dog, parts the fur, and bites down. As the tick feeds, it naturally secretes saliva into the wound, and right along with that saliva, the Babesia parasite swims straight into the new dog's bloodstream.
But here is a totally critical detail for all dog owners out there. 24 to 72 hours. That is the typical window of time a tick actually has to remain actively attached and feeding to successfully transmit the disease. It doesn't happen the very second they bite. This means if you're vigilant and you physically check your dog after a walk, removing any ticks quickly can literally stop the invasion before the parasites ever make it to those salivary glands and into your dog.
However, while ticks are the main culprits, they aren't the only threat. Think about the alternative routes of spread. If a dog receives an IV blood transfusion using infected donor blood, well, you're bypassing the tick entirely and dumping the parasite directly into the recipient's veins. Then we have dog bites. When fighting breeds, or frankly any aggressive dogs, bite each other, there is a direct transfer of contaminated blood right into the open wound. Actually, this is particularly common with a specific smaller species called Babesia gibsoni. And finally, the spread can be transplacental, meaning an infected mother can tragically pass the parasite directly to our unborn puppies right in the womb.
Section 3, the microscopic blood battle, the parasite's life cycle.
Okay, so let's assume the parasite has successfully breached the perimeter. What does it do once inside? It creates a continuous, highly destructive loop. Step 1, the parasite finds a red blood cell and attaches itself. Step 2, it forcefully breaches and enters a cell. Step 3, it completely hijacks a cell to multiply, churning out copies of itself. Step 4, the sheer, overwhelming volume of parasites causes the red blood cell to violently rupture and explode. Step 5, these newly released parasites immediately swim out to find fresh, healthy red blood cells, and the cycle repeats. Attach, enter, multiply, rupture, over and over and over again, rapidly depleting the dog's red blood cell count.
And honestly, this brings us to the real tragic secondary response of the disease. First, obviously, there is direct red blood cell destruction, the parasite literally blowing the cells apart from the inside. But then we have immune-mediated destruction. This is where the dog's own body basically turns against itself. The dog's immune system realizes something is terribly, terribly wrong and starts aggressively attacking the infected red blood cells. But in its chaotic panic, the immune system overreacts. It starts destroying perfectly normal, healthy red blood cells too. More often than not, this immune-mediated destruction is actually far more severe and dangerous than the initial damage caused by the parasite alone.
Let's move to Section 4 and see how this builds. Organ system meltdown, a system-wide crisis. So, microscopic cell death doesn't stay microscopic for very long. It inevitably cascades into macroscopic organ failure. Just think about the cause and effect map here. Red blood cells carry oxygen. When they're destroyed in massive numbers, the dog develops severe anemia. Anemia causes hypoxia, which is just a medical term for a severe lack of oxygen reaching the tissues. When the brain, the liver, and the kidneys are starved of oxygen, things escalate incredibly fast. The body enters an inflammatory cytokine storm, which is basically a system-wide inflammatory panic. Then, all those ruptured blood cells release free hemoglobin, which is highly toxic to the kidneys, leading to acute kidney injury. The lungs suffer from severe inflammation, causing acute respiratory distress syndrome, or ARDS. Ultimately, this cascading domino effect leads to MODS, multiple organ dysfunction syndrome. At this critical point, the liver, kidneys, lungs, and brain are all simultaneously shutting down.
Section 5, Spotting the Warning Signs. What the owner sees. Now that is a terrifying internal picture for sure, but let's shift our perspective back to the outside. What does a dog owner actually see happening? Because we just covered the internal biology, these physical symptoms are going to make perfect sense to you now. Fever and lethargy, those are the first general signs of the massive immune response and oxygen deprivation. Pale mucous membranes, like the gums turning totally white, that happens directly because of the severe loss of red blood cells. Jaundice, a yellowing of the skin or the whites of the eyes, occurs because the liver is just completely overwhelmed trying to process the massive amounts of bilirubin from all those destroyed blood cells. Dark urine, specifically hemoglobinuria, happens because the kidneys are filtering out all that toxic free hemoglobin we mentioned earlier. And the enlarged spleen, well, that's because the spleen is working in absolute overdrive trying to filter out all the dead and infected blood cells from the dog's bloodstream. But keep in mind, not every dog is going to show the exact same timeline. The disease actually presents in 4 main ways. The paracute form is sudden, overwhelming shock, often leading to death before the anemia even fully develops. Then there's the acute form, which is the most common, showing those clear symptoms we just walked through. Chronic cases can persist for months with mild anemia and weight loss. But look at that last one, the subclinical carrier. This is the hidden threat. The dog might appear totally perfectly normal, but they harbor the dormant parasite inside them. They become a walking source of infection to other dogs. And a sudden stressful event, that can trigger the parasite to wake right back up and cause a full-blown relapse. Moving to our final section, Section 6, Diagnosing Canine Babesiosis, Solving the Medical Mystery. So, if your dog is showing these signs, or maybe they're a suspected carrier, this is where your veterinarian steps in to basically act as a medical detective. I mean, they have to uncover an invader they literally cannot see with the naked eye. So vets use a specific toolkit to detect the aftermath of this microscopic battle. The most common method is a simple blood smear looked at under a microscope. Vets are physically looking for the organisms inside the red blood cells. The large Babesia species, they look like little paired pear-shaped drops, while the small species look like tiny rings. If that doesn't give a clear answer, they turn to PCR testing. This is the absolute gold standard. It searches for the parasite's actual DNA, making it highly sensitive and able to identify the exact species at play. Finally, serology testing looks for antibodies. It tells the vet if the dog's immune system has ever been exposed to the parasite at some point in the past. So the absolute crucial takeaway here is this specific diagnostic pattern. Veterinarians refer to this as the golden triad. If a dog comes into the clinic presenting with anemia, meaning low red blood cells, plus thrombocytopenia, which means a low platelet count and is an extremely early sign of the disease, and a known history of tick exposure, well then babesiosis absolutely must be at the very top of the suspected diagnosis list. That exact combination is the hallmark signature of this invader. We've tracked this crazy journey from a seemingly harmless walk in the tall grass to a single tick bite, down to the explosive destruction of microscopic cells, all the way out to a system-wide organ crisis. It's a heavy, heavy topic, but understanding the enemy is always the first step in defeating it. So, knowing the rapid, devastating microscopic war that just a single tick or a contaminated blood exchange can start, how will you protect your dog tomorrow? Keep those tick preventatives updated, thoroughly check their codes after a walk, and stay vigilant out there. Thanks so much for learning with us today on The Explainer.